Good afternoon. I'm Trina Sheets with the National Emergency Management Association, and I'd like to welcome you to the NEMA webinar entitled ASPR Technical Resources, Assistance Center, and Information Exchange. Thanks for being with us today, and now it's my pleasure to introduce our presenters. Shane Brandman has extensive experience conducting independent evaluations and assessments of government healthcare policies and programs. She's worked on health issues for the Navy and Department of Defense healthcare systems, the Office of the Assistant Secretary for Preparedness and Response at HHS, and the Agency for Healthcare Research and Quality. She's an established healthcare executive with more than 30 years of experience within both strategic and operational settings. Ms. Brandman is the ASPR Director for TRACIE, lead for Crisis Standards of Care, and works on interagency healthcare system stress efforts. Megan Trevor has over 23 years of experience in emergency public health and medical preparedness and response and emergency management. As a first responder, she has served as a departmental emergency medical services chief, situation commander, line officer, and practicing paramedic. As a senior analyst for HHS, Office of Assistant Secretary for Public Health and Emergency Preparedness, Ms. Trevor served as the operations chief. Following her federal service, Ms. Trevor held numerous senior leadership positions for the Commonwealth of Pennsylvania, including serving as the director for the Office of Public Health Preparedness within the Pennsylvania Department of Health. She's currently a principal for Public Health Preparedness Practice for ICF International and serves as the ICF TRACIE Project Director. At this time, I'll turn the webinar over to Shane Brandman.
Thank you, Trina, and thank you for coordinating this wonderful opportunity. And good afternoon, NEMA colleagues. We know you have very demanding and hectic schedules, so we appreciate you taking the time to learn about one of ASPR's new initiatives called the Technical Resources Assistance Center and Information Exchange, affectionately known as TRACIE. We are all looking for smarter and more efficient ways to keep the people who rely on us on a daily basis to keep them healthy, safe, and informed when a disaster or event strikes. Finding the right and best information possible can be a lot harder than it sounds, and that's where TRACIE comes in. Dr. Nicole Lurie, Mr. Ed Gabriel, and Mr. Don Boyce actively listen to folks like yourselves and those across the country involved in preparedness and response and recovery activities. They heard that we had a need for TRACIE and that we had to be able to have a healthcare emergency preparedness information gateway to address the different gaps and needs that just weren't enough people out there to be able to do. So we needed to be able to provide enhanced technical assistance and provide a watering hole, a one-stop national knowledge center for healthcare system preparedness, and find ways to efficiently share and receive what we call a push-pull information between the various entities, including peer-to-peer. We know at the federal level we don't have all the answers all the time and all the good work that's being done at the state and local levels. We want to be able to share those experiences and leverage each other's good work and thoughts and thinking, and collectively get smarter by integrating the information and resources that we share, and TRACIE wants to be a force multiplier to be able to do that. Megan Trevor is going to give you a demonstration of TRACIE, but I just want to give you a little orientation before she does that. Again, TRACIE is broken down into 3 domains. We have technical resources, which is a self-service collection of audience-tailored materials. We have a lot of subject matter review topic collections, and Megan's going to give you a couple of examples that we think are germane to emergency management. And then again, we have unpublished and SME peer-reviewed materials highlighting real-life tools and experiences. TRACIE isn't just for academia, it's really trying to bring the best science together with practical operational tools so that we collectively are intersecting those two worlds together more on a daily basis. But sometimes you can go into TRACIE and no matter how good a system is, and ours is pretty darn good, you just can't find what you're looking for, or you don't have time to look and be able to fish around TRACIE. So we have an assistance center as well. So if you're stuck or need help and something that we can help you with on healthcare system preparedness activities, You can email us, you can do an online form or call us, and we have not a call center, but an assistance center staffed by 3 qualified individuals that have extensive experience in public health and medical response activities and preparedness. And they're here to help you, and if they can't help you, that's why the subject matter expert stable is so important, is we have a large cadre of not only ASPR staff, but across the continuum of the government and in academia, in local, in states that help us respond to the different questions that are out there. And then the third element of TRACIE is the information exchange, the IE part, where we have peer-to-peer discussion boards and the ability to share templates and plans and other materials through a password-protected discussion venue. And Megan will show you that in the demo ahead. But those are the 3 domains of TRACIE. Unique features, as Megan walks you through the demo, it's a very collaborative development. No one entity, no one source has all the answers. We need to collectively work together to be able to share information and resources so we can all get smarter at the same time. The topic collections, again, our prism and intersection point is healthcare system, but as it intersects with emergency management and public health and other venues out there, we're trying to be the best collection of information on healthcare systems and the intersection points among that. We have a wide cadre of individuals, of SMEs, who are established in their profession to be able to assist us. We're nearing about 300 individuals in our stable right now. Again, I talked about the Assistance Center. Megan will show you a little bit about the information exchange. And something that hasn't been historically done within the federal government was purposely asked for by Dr. Lurie, is the ability to provide feedback. So we have dashboard and we have the ability to tailor the experience for you so that if you have searches, you can save them and you can provide us feedback on, hey, this is really, really a good resource and should be viewed by a lot of people, or this isn't so much. And we need to be able to accept that feedback and engage with you on what is the most important information out there so we can all collectively get smarter. Next. Again, we want to be able to talk with you at the end of the discussion. Megan's going to be able to give you a 15-20 minute overview here of TRACIE and kind of walk you through so you get a sense and feel of TRACIE. It's pretty intuitive, but she'll navigate you through some of the caverns. And then we want to be able to talk with you. We'll have at least 20 minutes to 30 minutes left over so that we can engage with you and have a rich discussion on subjects that are important to you. And more importantly, how we can make TRACIE better serve your needs in the days ahead. Next slide. And again, we want to be able to sustain this collaboration with you when we hope that this is the beginning of a dialogue and not the end of the dialogue. And we look forward to your questions at the conclusion of Megan walking us through the demonstration. So with that, I'll turn it over to Megan Traber. And again, thank you for the opportunity to inform you about TRACIE today.
Thank you so much, Shane. So here you'll see this is the website, and as Shane mentioned, TRACIE is a system that has a lot of intersecting and overlapping parts, and the website is certainly a focal point and is an excellent entry point to TRACIE. But TRACIE is the resources, and it's the people, and it's the system that are there to support anybody who has any kind of an overlap or intersection with healthcare system preparedness, public health preparedness, emergency management, and disaster clinical medicine. So this is our website. This is the homepage. On the homepage, you can easily navigate among all of the domains. We've designed the website so that it is as close to ease of use as possible. We like to have you be able to get around within 4 to 6 clicks or less. It is also, I'll mention, we've developed it in responsive design. So anything that we change on the website or update on the website is immediately available in mobile versions. We think it displays really nicely on tablets and phones. It's pretty easy to use on the go as well as on your desktop. Again, this is the homepage. We have multiple ways to get into our different domains. We update our in the news section here at least weekly, although lately we've been updating it much more frequently because we've had lots of things happening on a regular basis. I will note here the very top one, in case you're following along on your own screen or device, is a link to our first issue of the ASPR TRACIE newsletter, The Exchange. It is on crisis standards of care, which is an issue that is it's really quite critical to the whole community in preparing for disasters. So I encourage everybody to click on this link here and take a look at our newsletter. We will certainly have more issues and let you know. You are able here to subscribe to our ASPR TRACIE listserv so that you can get the next issue of The Exchange or any other publications or updates that we push out. We are very careful, I will say, to not overload anybody's email. So you will not get a weekly update for us or even a daily update for us. We really try and limit it to when we have truly critical information that we want to make sure everybody sees. There's also a button right here on the home page, and actually it transfers to all the pages right here, to become an ASPR TRACIE subject matter expert. We have an application, and then it is reviewed against sort of a review panel to be in our subject matter expert cadre and help us with different aspects of TRACIE. And then we have here some ASPR TRACIE resources, things that we like to highlight. I'm going to navigate right now to the technical resources page, where you can do a couple of things. You can search, do a keyword search here for anything, medical surge, disaster plans, whatever strikes your fancy, and it will return a search result for you. Or you can search our topic collections. These are comprehensively reviewed, basically annotated literature reviews that have been reviewed by subject matter experts to help determine what is the best and most relevant information on any particular topic collection. I'm circling here with my mouse. If you click here, it brings up a full list of all 65 topic collections. I'm going to go through ones that I think are of particular interest to the emergency management community and show you a few of them. And I'll show you, let's go to Emergency Management Foundations. And then here is quite a few of them. I think here's hazard, vulnerability, and risk assessment is a good one. This focuses on healthcare system and hospital hazard, vulnerability, and risk assessment, and public health components of community risk assessments. But certainly we've included the THIRA and other relevant risk assessments and threat assessments that are pertinent to this community. All of the topic collections are set up the same way. All of them are available here on the screen and also here in a 508 compliant PDF, so that you could download it, email it to somebody if you want them to see it, or print it and take it with you. We really like it electronic because we give you right here, we just link straight to the resource. So you don't have to copy and paste it into a browser, you don't have to look for it, it's right here for you. All of the resources are, like I said, reviewed by a panel of topic area contributors from within our subject matter expert cadre. These are folks who are experienced in the area, published in the area, really identified as the go-to people in whatever the particular area is. And we organize all of the resources for you we have some standard subcategories here, but then we tailor them for the particular topic collection. So every single category has a must-read section. And we love this must-read section. The direction to our subject matter expert reviewers is, if the person searching, if our TRACIE user only has a few minutes and they need to get to the heart of the issue, what are the things, maybe we tell them generally we like to leave it in 10 to 15 documents or less even. What are the ones that they absolutely need to look at that will help them get where they need to be, to get smart on the issue very quickly? And so that's in our must-read section. Then we break them, like I said, we break them down. All of the sections have this section right here. All of the topic area collections have this section right here, plans, tools, and templates. As our directive was really, there's lots of great literature, there's lots of great published material out there, but you know, healthcare system, emergency management, disaster clinical practitioners. Sure, we want to make sure they have the science behind it, but an illustrative example, something that I can take and implement, something that a subject matter expert reviewer has looked at and says to me, this is an A, is an A plan. I can Google hazard vulnerability assessments for hospitals, and what I get in as a search result, I don't know if what I'm looking at is an A+ document, an A- document, or a D- document. TRACIE helps to filter out the noise and get down to what we really need. So I will show you a couple more of these topic collections. They're organized per these categories. You can scroll completely down the screen, or you can hyperlink to them. And I'll show you right here. This is the ability to rate or to comment. You have to be, if you look up at the top of the screen here, I am logged in. You have to be logged in to be able to rate or comment. But if you haven't logged in yet and you click on this to rate or you click on this to comment, it will automatically take you to the login screen and then return you back to your resource so that you can rate it. This is something that we're very excited about, the ability for you to provide immediate feedback right here for us and tell us if this resource was valuable or helpful or not. I will let's go to response planning. This is another group of our topic collections. Emergency operations plans, incident management, state and federal emergency management support. One of the things that we really thought through in creating these 65 topic collections is, especially with regards to the intersection between public health and medical work and emergency management work, is that there are public health and medical issues with virtually every disaster scenario you can think of. There's going to be some sort of either direct or tangential public health implication. Public health needs emergency management fundamentals, as do healthcare systems. They need to organize under NEMS, they need to have incident management, and they need to adopt the general constructs of emergency planning. And so we've provided them those foundational pieces here. Let's click on incident management, just so you can sort of get a look. See, same setup, same familiarity, but then we've broken it down to some specific subcategories that apply specifically to incident management. And then emergency management really can benefit from an understanding of the public health and healthcare system issues. So we have topic collections that are relevant as well. This is our overarching systems issues sort of category, and there are lots of areas here that intersect disaster ethics, access and functional needs, patient movement, resource management. These are all issues that absolutely intersect. And I'll take you to one more area since you can search this yourself and sort of get familiar with it ourselves. But we also have this specific hazards and patient care topics issue, and we think this is really valuable. This can help a non-healthcare, non-clinician get smart on an issue very quickly. We have burns. We have an area for burn care, chemical incidents, explosives and mass shootings, which sadly in this day and age is one of our most downloaded resources. Any of these areas here so that someone can get smart very quickly on the implications and considerations for these particular topic collections. And then the next, as you can see, you can navigate from anywhere inside TRACIE to any one of the other domains. And so the Assistance Center, as Shane mentioned, if you're in the technical resources area and you are searching but not finding what you're looking for, or you need more assistance than what you're going to be able to find with just technical resources, our Assistance Center is staffed Monday through Friday, 9 to 5, by experienced public health preparedness, healthcare system preparedness folks who you can reach through an online form that you can fill out right here on TRACIE. You can call a toll-free number that, again, is staffed during our operating hours, or through an email address. The majority of our almost 300 now TTA, technical assistance requests, are through email, but we do get a fair number of phone calls and web forms. So we meet you where you're at. Any medium that makes sense to reach us, we'll be there for you. So this is our, I'll also point out here that we have a summary available. I'm moving the mouse across here. Click here for a summary of our sample TTA request. So we do provide a little high-level overview of the types of TA requests that have been submitted and the kinds of responses that folks get. And then within the information exchange, which I'll show you in just a second, we actually place redacted versions of our most requested TTA topics so that you can review and look at them yourself and get smart yourself without having to call in yourself. So the next area is and you'll notice that the home screen, that's all of the technical resources and the entire Assistance Center, this is all publicly available. You do not have to log in. You do not have to give us any information to get access to this. You have to log in to rate and comment on a resource, and you do have to log in and register for access. And I'll click right here and show you the form to get into the information exchange. And we're not asking for a lot of information: first name, last name, email address, where you're located, what you're doing, and we do ask for a reason for access for the information exchange. We do that so that we can verify the connection to the healthcare system preparedness, emergency management, or public health preparedness community, and we can cut down on any kind of, or at least attempt to cut down on any kind of solicitation or spam. You'll also see that you are automatically checked in here. If you register for access, you will automatically be added to our ASPR TRACIE listserv, and you will automatically be added to the to your request for access to the information exchange will be submitted. Your registration is immediate. Your access to the information exchange will take up to 24 hours, since it does have to be, we have to manually approve you. We have to review the application and verify who you are. So that does take a little bit longer. So it's not, just don't expect it to be immediate. And then once you're in, here's the information exchange. And again, if you haven't been logged in and you click on information exchange, the system will automatically force you to log in. If you click somewhere, if you receive an email from us, or you get a link from someone that maybe is to a thread directly into the information exchange, and you're not logged in, it will bring you to the login page. You log in, and it'll immediately bring you to your thread. So it's a nice, responsive design that it is. We certainly hope that it's as user-friendly as possible. So the information exchange is a community discussion board. If you've been on any other, either one for your personal use or perhaps another board like FEX or other discussion boards that are out there, it's really designed to be a place where if you've gone, we like to think of it as a layered approach, right? You've gone to the technical resources and done some self-service and found your own, hopefully, resources, or maybe you've gone up to the next level and reached into the Assistance Center and either we've supported a response or we've reached out to subject matter experts for you. And if that, if that's not what you're looking for, or you want a kind of different approach, the information exchange provides an opportunity for you to post a question and ask your peers. Does anybody, we've had, I'll scroll down here, we've had some really nice conversations. Here's one right here: hospital readiness capability assessment. Is ASPR TRACIE aware of any hospital emergency preparedness and capability tools or templates? And then we've had some folks that responded and provided, here, I'll show you right in here. And so we had some people that provided a response, and we were able to get them the answers that they needed. So we have a couple of threads that are active right now. I'll go back to recent activity. We are using the information exchange discussion board to solicit input on the any changes or additions to the performance measures being used in the hospital preparedness program cooperative agreement, and also to take a look at the capability, right here, the capabilities document. We also post, like I said, we post responses to our TTA, our technical assistance request here. The automatic default screen when you log in is the recent activity. It just makes sense. You can get to what's happening, what's hot, but you can also search by just the category. So again, we've sort of stickied the two that we're interested in up top, but then you can search by the other categories. So right here, right at the top is the ASPR TRACIE sample technical assistance responses that you can go in and take a look at yourself. And then there's a few other areas that we keep current and we keep moving. The ASPR TRACIE team, handle the categories. You are free to post within a category and a topic. Any user is free to start a thread or a post to respond to a thread. So you can put a question in there on your own, you can respond to it on your own. Each post, you are able to upload up to 3 documents. So if you want to share something, you're welcome to do that. This is sort of at user risk, so please don't share anything that shouldn't be public. Even though it's behind a password, we have over 1,000 members in right now, so you just have to be aware that you are sharing something on the internet. If you do have something that you'd like to share, something that you think should be in the technical resources area, or even something that you would be comfortable sharing, not on the website, but perhaps if the ASPR TRACIE staff received a TA request, we vetted the user, we knew who they were, perhaps you have a plan that you'd be willing to share. We have a number of folks who are perfectly willing to share their plans or their resources peer-to-peer through TRACIE, but are not interested in sharing it on the internet, and we completely understand that. We really just wanted to provide a forum and a platform for open dialogue with your peers. So with that, I've covered the website. That's TRACIE, and I'll turn it back to Shane.
Thanks, Megan. And again, we want to be able to get to any questions you might have or clarification, so we look forward to that exchange. Just a couple exclamation points. So TRACIE, emphasis is on healthcare system, emergency preparedness, and those intersections with professionals like yourself in emergency management and public health, and how we can collaboratively get smarter and work better together, and that locals, states, regionals have a lot of great information, a lot of practical applications and tools that we'd like to be able to share across the continuum of the nation so we all collectively get better. And if the federal government or academia has something that they think is worth sharing, we can push that out as well and collectively try to get better for a better healthcare system, better ability to have an effective preparedness, response, and recovery activities. The thing that kind of sets TRACIE aside that we didn't have the ability before we established TRACIE is to have the ability to denote what we think is best in show or most promising at this time based on a review. And the review panel is not just people here in DC. We incorporate individuals from locals and states, and we cherish that because it helps us review it from a systemic aspect, so that we try to ferret out for you and highlight what is the most promising tools, practices, and must-reads. There's so much turnover. There's so many challenges that we're all facing on a daily basis that we have to be able to get smart very quickly, and TRACIE allows us to be able to do that. And again, we want to hear from you. We're babies. We're only about 4.5 months old. We formally launched TRACIE on the 30th of September. We already have had about 30,000 visitors to TRACIE. We have over about 300 technical assistance requests and a lot of different initiatives that we're working with folks on. And so it seems to be working really well. We've gotten a lot of positive feedback, but it's organizationally lodged within the Office of Emergency Management within ASPR. And certainly Mr. Boyce wants to be able to better meet your needs in the days ahead and make sure that TRACIE is nimble and adaptive and hearing what you need us to do better to meet your challenges. So with that, Trina, we'll pass it back to you and take any questions anyone might have.
Okay, thank you, Shane, and thank you, Megan. Just a reminder for everyone, if you have a question or a comment, please type it into the question box on your toolbar on the side of your screen. And even if you don't have a question, if you could see a way where this would be useful to you, if something stands out, we'd like to hear that from you as well. I see we do have one question, which is, are you using Gov Delivery?
I'll let Megan explain the technical aspects of TRACIE, but we basically have made a decision to go with that contractor-owned, contractor-operated aspect. And Megan, you can talk a little bit about their question.
Yeah, so for our listserv, we do not use Gov Delivery. We use Lyris is our software system for that. It allows us a little bit more flexibility, to do that. But it is done through a hhs.gov email address, so you shouldn't have any issues getting it into through institutional firewall.
Okay, our next question is, could you clarify or just go over one more time how one would go about sharing a plan, a document, an after-action report, etc. You did talk about how to post those in the information exchange and a discussion thread, but if someone wants to have something considered for the other areas of TRACIE, how do they go about that?
You bet. This is a great question, and thank you for it. This is Shane, and I'll have Megan augment with some of the technical aspects. But I think it's really important to point out that you're not required to use the information exchange. It's another vehicle. But if you have something that you think is worthy and you want to be able to have us share it across the continuum of TRACIE, you can simply email us at ASPR TRACIE, or you can contact myself and email it to us, and we will evaluate it and get back to you on exactly the different ways that we will lodge it within TRACIE and be able to share it. It's pretty simple, but if you want to have a specific discussion board about it or those aspects, then certainly the IE may be better suited for you. Megan, would you like to augment on that answer?
Sure, just a couple points. So the email address is aspertracie@hhs.gov, and you can certainly email anything that you would like us to consider. Like Shane said, we do have sort of an editorial review board that would review before we put anything specifically in a topic collection. But if you were interested in us having, it in our resource library, we can certainly consider that. The other thing that we didn't really discuss was within the information exchange, we do have the ability, and we are just getting ready to launch our very first private thread. So if there's maybe a document that you're working on, say your jurisdiction is starting to work through issues maybe for Zika, since that's the topic du jour, and you'd like a space where you could have some discussion. We're not a SharePoint site, so this is not something where you would store files and have a big file storing directory kind of thing. But if you wanted to talk through some issues and you didn't want that open to all the members of the information exchange, we do have the ability to create private topics and private threads. You would just provide us with the email addresses. Everybody would obviously have to register for the information exchange, but we'd have to provide, and you just give us the email addresses, and we can restrict access to that particular area. So there's a bunch of different ways that you can reach us. If the document's too large to upload on TRACIE, you do need to be wary of that, and we do have some firewall restrictions for security reasons. But if the document's too large to share via email, we also have some file sharing options that you could get to us. So there's lots of ways. We can also link to if you have a document perhaps up on your website, we can provide a link to that if that's the best way to do it. So there's lots of ways. Really, email us, call us. Click on the web form, any way, homing beacon, any way, we'll respond. Thanks.
Okay, we have another question. This one is very timely. It asks, the individual is asking, what information do you have, and this would be off the top of your head, on hot topics, using examples like the water crisis in Flint and Zika virus?
You bet. This is Shane, and I'll again defer over to Megan to give some specific examples. But we work ASPR, and so we're right in the thick of these things with you. And so we do have hot topic ability to quickly assemble documents of relevance, and we just worked this last week on a document on Zika that we are internally staffing right now. But we get people smart very quickly, and that's the nice thing about this subject matter expert stable. And when I say subject matter experts, again, I just want to reiterate, that's not just folks here in DC, that's across the nation. We have a wide diversity of individuals that come together from different disciplines, professions, and diverse settings in parts of the country, and assemble very quickly and help us get smart on subjects that are fast emerging. And I think that's one of the areas, if I were emergency manager, and you have something coming down that has an overtone of healthcare delivery, we can help you get smart real fast. And certainly Dr. Nicole Lurie is the lead for the Flint, Michigan, as the lead federal authority, and we've all gotten very quickly smart on a lot of topics about that, and we partner with the National Library of Medicine and others to get, we don't have to invent anything, we just want to assemble the best knowledge and resources possible to be able to provide those, and you'll see that on TRACIE already. Megan, want to put an accentuation on anything?
Yeah, so Shane sort of mentioned that we do try not to duplicate anything. So if we think that there's a resource out there that is sufficient at providing information, we will, rather than duplicate it, we'll link to it. So for instance, for Flint, phe.gov, Public Health Emergency, phe.gov, is ASPR's homepage, and they have created a beautiful web page with resources that are applicable to citizens in Flint, clinicians, emergency managers, and others. And so right on our homepage in the news, it's the second bullet, we have a link to that web page that you can just get right there from TRACIE. There are also our technical resources database also links directly to the National Library of Medicine database, their disaster lit database, so we don't duplicate those resources either, but you can access them from TRACIE. So if you, I don't have control of the screen anymore, but if you were to go to the technical resources button and then go down to the search bar and search for what you were looking for, it would bring you a compilation of TRACIE resources and NLM resources right there. Shane also mentioned Zika. We do hope to have something available really quickly, really soon on Zika, but there are individual resources that are available through our search bar as well. So we do have those.
Katrina, just one more comment on this before we leave this great question, is that if there's something you need to know, call us, email us, and we'll quickly, if we probably have a good idea about it already, but if we don't, we can quickly assemble. And again, I think that's an important point that I want to make sure that we discuss just a little bit here. In this world where we have so many different turnover and transitions and challenges, is that when you're asked to scoot out the door to a specific event or incident, you need that just-in-time document. Let's give an example, like the dialysis community. If you've never dealt with the dialysis community and you have an incident going down, we have a wonderful document that we worked with the Kidney Community Emergency Response Coalition, and we're able to assemble the facts you need to know, not a lot of talking, just right to the point of what you need to know about the dialysis community very quickly. And again, those kind of topic areas can really help someone who's kind of new to emergency management or to an event or incident at hand and need to get smart very quickly on some subjects. And if they feel like they still have a deficit in knowledge, they can ask ASPR TRACIE and email us, call us, or do an online form, and we're there to support you because we want to make you the best professional possible.
Okay, we have not a question, but a statement from someone on the line who says, from an emergency management perspective, I'd be very interested in viewing what you have related to radiological and nuclear incidents.
You bet, and if we can get their email address or phone number, Trina, we'll personally contact them. We're very blessed. Again, that's an interesting issue. We're taking it through the lens of healthcare systems, preparedness, and those intersection points. We're very blessed to have within our SME stable Dr. Norm Coleman from the National Institute of Health, who's a renowned radiological expert, and Captain Kevin Sheehan helped us assemble some of our topic collections, but we also have a C. Burney unit within ASPR, and we're leveraging, we have access to their resources as well. So depending upon what you need to know, we feel in a position to be able to answer you pretty thoroughly or connect you to someone who will give you the knowledge that you need. Megan, anything you want to add?
Sure, and just short of doing that, just right now, again, I don't have control of the screen, but if you go to ASPR TRACIE and you click on Technical Resources and you scroll down to our where it says Topic Collections and a couple ways you can get, there's like 3 or 4 different ways you can get to it. But we have a radiological and nuclear emergency topic collection that is already comprehensively reviewed by a stable of subject matter experts that has, like, you know, like I showed you, must read, different categories. You can get to it by clicking on our list of the comprehensively developed topic collections, or you can click on the box for specific hazards and patient care topics. And it's like the 1, 2, 3, 4, 5th one down, radiological and nuclear. So that was one of the early topic collections that we completed. Like I said earlier, we have 65 of these sort of plain English descriptive topic collections, and we have completed our comprehensive review that includes subject matter expert review for 31 of them. For the other ones, there are still subject matter expert recommended resources in there. They just have not yet been comprehensively reviewed. But radiological and nuclear has, and it's one of our largest collections to date. So it's right there. And again, if you send Trina your email address, we can provide you a link and send you the PDF.
Okay, we will be glad to follow up with you all with the gentleman's email, so you can respond directly to him. Thank you for that. We don't have any other questions at this time, so I will remind everybody that you can download the slides from today's presentation under handouts on your toolbar. I'd like to thank all of you for joining us today for the NEMA webinar, and thank you, Shane, Megan, and all of our partners at ASPR for taking the time to share this really great resource for emergency management. We appreciate it and look forward to using this resource and having contributions to it. So with that, the webinar is concluded. Thank you.